Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Okay, we're back from the break, and what Steve was talking about, the non-medicinal treatments. The marijuana is a big topic on the show, and Ray brought it up about the medical cards. So that's also a nice adjunct to
avenue,
to use to help reduce someone's pain and anxiety. Anxiety goes with pain. When people, I do hospice medicine, and when the nurse is calling me for the third pain medicine increase on a patient, I always know it's anxiety. So just by adding an anxiolytic like lorazepam or Xanax, I immediately cut off the need for more opioids, because that's where anxiety is out of control, pain goes out of control. So that's part of that stressful issue too. So, hey Chuck.
Hey Doc, how you doing?
Hey Chuck.
Hey, I stopped by the Wellness Center and delivered a DVD for Dr. Christensen on chemtrails. So now both of you should have it.
I promise you I will watch it before my partner.
Good. Actually, you got 4 things on your DVD.
Well, I wish you'd have stopped in and said hello, buddy.
Well, I waved. You were in the hallway. God, I couldn't believe how busy. You guys are doing great.
Yeah, we're doing real well. People have found out that what we do is the real deal, and we're just as busy as we can be. And
yeah,
thank you, Pahrump.
I thought I was at Walmart.
Yeah.
Hey, on that medical marijuana, I've been trying to get information, which is like pulling teeth. But absolutely, the last thing I've seen is question 2 says the measure permitted individuals 21 years of age or older to grow up to 6 marijuana plants for personal use. It required cultivation to take place in an enclosed area with a lock. And that's it. No 25 miles, no nothing. So until someone says something different, I assume you can grow 6 plants, for personal use.
Yeah, and the you can get a waiver to grow more if you have a medical marijuana card. So I think you can grow up to 12, but if you get an edibles waiver, then they can allow up to 20-something plants. So that may be the benefit for, and even on the medical marijuana card, you check on the place that even if you live within a small, within 25 miles of a dispensary, you still say if it's taxing for you to get to a dispensary, you can still grow. Mm-hmm. So they haven't really cut it out, but if you fail to check that box and then you're found growing and you didn't want a waiver to the grow thing, you might be setting yourself up for a problem. So.
Okay, that's interesting, yeah.
Yeah.
I hope they come out with some guidance locally. From the DA did give the insinuation at the last meeting I went to that they're certainly not going to, go and make any efforts to prosecute people. So that was a good sign.
Well, it doesn't make sense for them to now.
Well, I mean, unless you're basically doing something flagrant and you're trying to, grow a farm, then yeah, you probably won't get prosecuted. But if you're doing it within the reasonable standards of the community, how can legitimately they waste a taxpayer's dollar on prosecuting you? And that would be something that the community would want to know, so that that district attorney will be looking for another job, wasting our money on stuff like that.
Yep, I agree. Okay, I'll get off the phone so other people can call. Thanks.
Well, I'm glad you called.
Thanks for the call, Chuck.
Yeah, it really, we can do a monologue all night, but I get tired of listening to me, and I know he does. So, we enjoy your calls, and prior to the callers that have come in, I had to do a lot of preparation with the PowerPoint program, and it was a lot of work to do all that. But the callers have really prompted a lot of information, things that we have to regurgitate and try and let you know that we kind of do know what we're talking about, right? I mean, we just don't make it up as we go along.
Yeah, this isn't fake news.
Yeah, right. Hey, even our producer laughed about that one. That's good.
In my day, fake news was gossip.
Yeah. Well, yeah, the election is over, but our man hasn't been
Accepted.
Yeah, he hasn't been sworn in yet. And we were just talking about the other day. I actually had someone who I had met, and I saw them on Friday. And when I went to Spain for a convention, we went to dinner, my wife, my friend, and these two other ladies. Both of them were attorneys. And this one lady, when Trump won, she's moving to Switzerland because she can't handle it. I'm just like, my God. Louie, what are you doing?
What's up,
Evening,
Lou?
gentlemen. How you doing tonight?
Good. How are you, Lou?
What's up?
Well, I got a question. Now, I take a lot of vitamins, and a person was telling me that if you take cinnamon will lower your blood sugar. Is that true?
I have heard that also, Louie.
I
I don't have a blood sugar problem, so I couldn't try it, but I've heard that cinnamon is can lower your blood sugar.
Because the reason I say that is once in a while I'll get the gout and stuff, and I'll take this cherry vitamin. It's called black cherry, and I take cinnamon, and it seems to knock it out right away. And sometimes people say that sometimes that gout has to do with almost like diabetes and stuff. And they said the cinnamon knocks down the sugar. And I was just wondering if, I'm going to take it anyway, but I was just wondering if that is the reason that the gout and all this other stuff goes away.
Well, gout's a uric acid problem,
But in my practice, when people come in, and I have a lot of people with gout, I send them for the cherry juice, and it's effective.
The cherry, I mean, it may do something.
I haven't heard of the cinnamon, but I'm going to add that on and see what happens.
Yeah, I mean, but I've heard cinnamon doing something for blood sugar, but this is all journal of irreproducible results, right? What works for you is not going to work for Joe or for Ray or the other people out there, but it's certainly worth a try than taking what we call a dangerous drug like a non-steroidal anti-inflammatory agent. One of the treatments I'll make fun of is colchicine. And in the day, colchicine was given to patients, and the instructions were 1 tablet every hour until pain relief or you vomit. So what a barbaric treatment, right? I mean, you're taking something and you're either going to vomit because it makes you sick or you're going to get pain relief. And what it did was it basically just shut down your white blood cells. It literally is a microtubule enhancer. It was kind of one of the, maybe they were using it in acute leukemia, colchicine, but they use it now in gout as a chemotherapeutic agent. So it basically just makes the white blood cells very lazy, and they can't move and they can't do anything. But you build high enough levels, it causes nausea. So, and now they came out with the new long-acting colchicine, which doesn't have that side effect, but You know, gout is a crystallization of uric acid inside your joint. So basically,
and it actually destroys the joints.
Right,
I mean,
where the white blood cells do, because they're trying. Imagine this: I take a teaspoon of salt and I put it in a glass of water and I stir it, and the salt goes into solution. It disappears. Let the water evaporate, and the salt crystals now crystallize on the side of the glass. Well, that's exactly what uric acid does. It remains soluble in solution in your body, but if you get dehydrated, you drink, you eat too much food, and you make too much uric acid, or you don't pee it out, then it builds up in your system, and then it crystallizes if you get dehydrated. So that's why alcohol is contraindicated in people with gout, because it causes people to diurese and become super concentrated, and the uric acid crystals can come in there. People on diuretics, Lasix and other medications are real prone to gout because it causes your kidneys to reabsorb it, so you don't excrete it. So you produce it when you eat and you excrete it when you go to the bathroom. And if any one of those two systems gets out of balance, then it builds up in your bloodstream, and then it can come out of crystallization, come out of solution and form a crystal. And then it's a foreign body in your joint, and your body tries to dissolve that foreign body, just as a splinter is in your finger. You know how irritated a splinter can get, right? That same process goes on in your joint.
But in total, I've seen joints completely obliterated with gout.
Gouty tophi, you know, because the white blood cells destroy, just like rheumatoid arthritis. You've seen a patient with rheumatoid, their joints are all deformed, they're all irritated because of the constant inflammation in that joint. So the key for gout is, number one, trying to, you know, they used to use allopurinol, right? Yeah. And allopurinol just prevents you from making gout. And people that don't have kidney stones can take probenecid that helps you excrete the gout, the uric acid. So there's lots of treatments out there, and there's a new medication that replaces allopurinol called Uloric, and it's very good. So if you're not on that, Louie, that might be something worth trying too.
Okay, thanks a lot. You answered my question. Thank you very much.
Thanks for the call, Louie.
Okay. You guys have a good night. Goodbye.
So just keep yourself well hydrated, and if you do get gout in this holiday season, when you're eating richer foods and you're drinking, be prepared. You might get into trouble.
Go get some cherry juice.
Yep. Yeah, I think that's a good, nice recommendation. And cinnamon, again, I could see where cinnamon would not help your blood sugar if you eat sugar and cinnamon together, right? Like a donut or something along that line.
Like a cinnamon roll, a cinnabon.
Right. Okay, with that, we're out of time. Thank you. We'll see you next week.